to struggle.
Hey everyone, I'm Dr. Samina Mitha and I'm a naturopathic doctor, and I'm here today with Dr. Kelly. She's also a naturopathic doctor, and today what we're going to talk about is heavy bleeding. It's something that we've seen often in practice, especially in our clinic here at White Lotus. We focus in women's health and fertility, and oftentimes we're seeing patients, from a variety of different ages, from as young as in their 20s to as old as like 50s, having issues with heavy bleeding.
Yeah.
So today we're going to talk about some of the signs and symptoms of heavy bleeding. How much is heavy? Because I think, as a society of women, we normalize how much bleeding we have, and we think it's normal, but we're going to talk today about what is heavy bleeding. The other thing we'll talk about are what are the common conditions that cause heavy bleeding, and then we'll go into one of our favorite prescriptions to prescribe in this case, that we've used quite often in our practice, and we've seen a lot of good benefit with it.
Yeah. So I guess the first thing is talking about like what is heavy bleeding itself.
Yeah, so tell us like what does it actually mean?
Yeah, so there's no like golden rule in terms of what is heavy bleeding, so you'll read different things online.
Yeah.
But we were just talking actually about how if you're changing, your pad or your tampon, your Diva cup every hour, that would definitely be considered heavy bleeding. If you're using more than 6 tampons or 6 pads in a day, that would definitely be considered heavy bleeding. Also, if you're bleeding beyond 7 days, so a period should definitely not be beyond 7 days, so that could be considered heavy bleeding depending on the flow between. The
other thing I was just thinking of is clots. A lot of patients report having like huge clots. And like, some patients even say they're like as big as like a deck of cards. Like that's...
Oh, I haven't had that.
Yeah, that's huge.
That's big. Yeah.
That's huge. So we need to really fix that. And I find that we're going to get to the treatment, but the treatment that we're going to describe is probably the best treatment for this. Definitely no class. And the other thing I was going to say is like that it's so, I guess, I would say like I'm so appreciative to like know that patients can actually deal with it. Like, this is crazy. You shouldn't have to deal with this.
Like flooding sometimes, like it coming out of nowhere. Women have to change their pants, and it's a lot.
It's embarrassing. It's debilitating. It's stressful. It causes you anxiety, and it's something that you don't need to deal with, and that's why we're here to help.
So some of the causes that we were talking about, so there's a lot of causes. So if you're dealing with heavy bleeding, it's important to figure out why you're having heavy bleeding. One of the top things to look at is like structural. Do you have fibroids? Are there polyps in the uterus? Other things such as endometriosis. The main symptom of endometriosis is a lot of chronic pain and cramping around the cycle, but heavy bleeding is a symptom as well.
Adenomyosis. The other thing to keep in mind is that if you have heavy bleeding, the first thing that you need to do is go and get a pelvic ultrasound. So that we can get some imaging, like Kelly's saying, and see what is happening in the uterus. Absolutely. That can give us clues for sure.
And there's something called estrogen dominance. So if you have a lot of estrogen in your body in relation to the progesterone, that can lead to a thicker lining. And if you have a thicker uterine lining, you have heavier bleeding. So that's a common cause I see a lot.
For sure. And so exactly what Kelly's saying, like the estrogen builds the lining, and then even progesterone is there. When we have a drop in progesterone, that's when the lining starts to shed. So it's really important to check your estrogen and progesterone on day 21, like we talked about in our last video.
One of the other interesting things I find is that iron, so the storage form of iron, ferritin, is actually, if it is low, it's associated with heavy bleeding. And at the same time, if you have heavy bleeding, you can have low iron, so that's a little bit of a vicious cycle. So if you are struggling with heavy bleeding, you definitely want to check your ferritin.
That's going to cause dizziness, lightheadedness, fatigue. Those are really big ones that we find that we're screening for, and then seeing that they do have heavy bleeding. So our treatment, which honestly...
our magical treatment.
we are trained in prescribing hormone therapy, bioidentical hormone therapy to our patients, which is an extremely big deal because these hormones are natural. They're unlike their synthetic forms that you would get in like a birth control, or even just like an estrogen and progesterone that you would get through pharmaceutical companies. This progesterone is actually bioidentical hormones that is produced from wild yam or soy. They put it into like a specific base, and then they make it into a suppository. So we found that giving progesterone suppositories can be extremely helpful in this case, because now we're getting the suppository into the uterus, or close enough to the uterus, right? To be able to really impact estrogen's ability to build the lining. So the progesterone really opposes estrogen, and that's where we see a decrease in bleeding.
Yeah, it's really, really effective, we've found. Yeah. We've used it on a lot of women, particularly if the women are having extremely heavy flow, and then they're having low iron and fatigue and all these symptoms, and you just need to get it to stop. It's extremely helpful. So we use it a lot.
Even in spotting, cases of like long-term spotting, that it can be really helpful at that point too. So if you're having like long periods, or like not having periods at all, then you're having like a long time or weeks of like spotting, and then you don't get really a period, like this can be really good to regulate the cycle too.
Yeah, absolutely. We love progesterone.
Cool. Yeah, so if you guys are having any issues with heavy bleeding, please seek out help from a naturopathic doctor who's trained in hormone therapy, because and knows how to use progesterone in cases like this, because it can be extremely helpful.
Yeah, absolutely.
All right.
Let us know if you have any questions.
Yeah.
We're
here to help.